Welcome to Courage to Save CPR podcast. CPR is all about saving lives. I am Candace, the founder of Courage to Save CPR Training LLC and the creator of Courage to Save CPR podcast. In this episode, we'll discuss what is cardiopulmonary resuscitation and why you need to know it. This episode is brought to you by Courage to Save CPR Training, LLC. We are an affiliate of CPR Wrap, a product made by Felicia Jackson, who has an amazing testimony for this creation. CPR Wrap Aid is an innovative tool that helps make CPR easier. In an emergency situation, just remove the product from its quick open package. Lay it on the chest of the sudden cardiac arrest victim and follow the simple instructions. Made with a non-woven fabric that is eco-friendly, this is more than a CPR mask. It provides visual prompts to guide the rescuer through the AHA, American Heart Association, recommended steps of CPR. To ensure sanitary protection, the non-woven chest overlay includes a mouth-to-mouth, one-way valve, or breathing barrier, and face shield. Order your CPR Wrap resuscitation aid today at our website at www.couragetosavecpr.com. As an educator, I know that there are at least 3 types of learners: audio, visual, and kinesthetics, or your hands-on learner. Because this is a podcast, I will be providing the audio recording to help my audio learners. For my visual learners, please check out our YouTube channel at Courage to Save CPR Training LLC. For my kinesthetic learners, please get a baby doll or a mannequin if you have one while watching the video or listening to the podcast. Do not practice on a real person. CPR or cardiopulmonary resuscitation is an emergency life-saving procedure performed when the heart stops beating. Everyone needs to know CPR because immediate CPR can double or triple chances of survival after a cardiac arrest. When the heart stops beating and there's no response and the person collapses, that's a cardiac arrest. Now, there's a difference between a cardiac arrest and a heart attack, which we usually, use synonymously. But with a heart attack, the person is still responsive. They're able to tell someone what's happening, like tightness or pain in the chest, neck, back, or arms, as well as tiredness, anxiety, and lightheadedness. There is a blood clot that has blocked the blood flow to the heart. Now, a heart attack can definitely lead to a cardiac arrest. So let's get into a scenario of a situation where we may need to perform CPR. Imagine you and your homeboy or homegirl kicking it, laughing, having a good old time. Then all of a sudden, your friend collapses. There were no signs of anything like that happening, but here you are. Will you freeze up? Will you call 911? Call the person closest to her or him? When a situation like this happens, we are totally caught off guard and have a split second to do what needs to be done or run. In instances like this, we're in a fight or flight mode. So the fight mode is perform CPR or some emergency action. The flight is you run out of fear. You don't know what to do because you're scared that you may make it worse. Learning CPR gives you the confidence to fight for that person's life, even if it's calling 911 or pressing hard and fast on the person in the center of the person's chest. So let's go over the steps prior to giving compressions, which are pressing the chest and hard and fast, or what we also call hands-only CPR. So step 1, we're going to check the scene, look around and see what has caused your friend to collapse. Sadly, it could be a gunshot, it could be lightning or anything like that. If the scene is not safe, leave and call 911. You cannot help someone if you are also caught in the crossfire. But if it's safe, tap and shout for a response. Now, when you tap, you want a response. So tap firmly or hit firmly on their chest and asking, are you okay? Calling their names. Are you okay? If there is no response, check for breathing. Put your cheek to their mouth and look at the rising of the chest. This should take no more than 5 seconds at most. If there's no rising of the chest and you don't feel breath on your cheek, move on to step 4. If no one is around, you call 911 and put the phone on speaker, or have someone else who is around to call 911. Now, when you ask someone to call them by name. Ask that person to call by name or by what they're wearing. So if it's a bunch of people there and you know who they are, Shanita, call 911. Or if you don't know the names, you with the red shirt, call 911. This limits the number of people who are calling 911 for the same reason. Then we start the compressions. After you've done those steps, it's time to get started immediately. Put one hand over the other. Place it in the center of the chest. Press hard and fast until help arrives, or until 2 minutes, or until after 2 minutes or so, someone around you could possibly relieve you. If no one else can, you keep going until there's responsiveness. Continue until there's their responsiveness. No one ever wants to experience an emergency where they have to perform CPR. But by being prepared and trained goes a long way. I really hope this helped. Please leave a comment if you have any questions in the comment section. I'll do my best to answer it. But also, don't forget to check out our website at www.couragetosavecpr.com. Check out our Facebook page at Courage to Save CPR Training LLC. On IG, Courage to Save CPR. On Twitter, at Courage 2 Save CPR. And at our LinkedIn, linkedin.com, CAWHIGHAM. Thank you so much for checking us out. Remember, it takes courage to save a life, including your own. Take care and stay tuned.